So community neurologists can play a key role in the development of new therapies for Alzheimer's disease. One of the limiting factors in trial designs and trial execution these days is our ability to get people to enroll in trials. So sometimes we project it's going to take 12 months to enroll people in a particular trial. It takes 2 years or 3 years to do it, and that really degrades the ability of the study to test its hypotheses. So when community neurologists encounter people who may meet the diagnosis of Alzheimer's disease, even if it's just clinical, refer the person on to a center that is doing a study. The center will then do some of these biomarker tests to see if the person in fact qualifies for the trial, and then we will enhance the enrollment in these trials and hopefully complete them in a more efficient fashion.
So I think the role of neurologists as a frontline consultant, and in many cases actually almost primary consultant or primary care, is very, very important in the timely detection, diagnosis, and appropriate management and disclosure of cognitive impairment and dementia. Even though we can't cure Alzheimer's disease, we can absolutely mitigate decline. We can care for individuals. It's a meaningful trajectory that we can put people on by in the earliest way, actually supporting them, getting a triadic relationship with the patient, with a care partner, and engaging other professionals. It's not just neurologists. So I think primary care clinicians really are looking for help in this domain, to be educated by neurologists, and want to know that what they do actually makes a difference, and it does, in managing comorbidities, which oftentimes go unmanaged for many, many years, in being able to shore up support systems, for people to go into clinical trials if they want, but really having the autonomy to be, masters and mistresses of their own fate early on, so they could put their, do whatever they want with their life for what they have left. And it's a question of really benefits, and it's also justice that's available. So what I hear is, primary care clinicians really look to neurologists for that support and that knowledge. And as a part of a team, I think neuropsychologists are very important on the evaluation diagnostic side, particularly when there's questions about, atypical syndromes that are not just memory. Maybe that there's a motor involvement or visuospatial language involvement, in rapid progression, in early onset conditions. And this is a collaborative effort with geriatricians, geriatric psychiatrists, PT, OT, speech therapists, RNs, PAs, really the whole spectrum of folks. And on the care management side, I think care managers are really important. If we can somehow get that involvement with social workers or psychologists or other folks, and engaging societies and associations like the Alzheimer's Association and making those connections are really important. And this is something our patients and families depend on us for. And we're in it together. None of us are going to be spared. If you see the demographics of this, we're all in it, and we're going to be affected. So we appreciate any help that neurologists can give for patients and families that are very deserving.